Ladies, when is the last time you went for a health screening or a cancer screening? Now, this is the most crucial first step in safeguarding not just your health, but also your peace of mind. I'm Jojo Struys and welcome back to HealthyHER. This is a video series dedicated to empowering women with knowledge, insights, tools, vital info on your health and well-being. How do we prioritize our health? And I'm excited to share that we will be joined by experts from Sunway Medical Centre Velocity on various aspects of women's wellness. In this episode, let's dive in and explore the importance of early detection and how do we empower ourselves with the knowledge and more awareness on female cancers. And I have with me here today Dr. Chuah, consultant ONG, and Dr. Hafizah, consultant oncologist. And we're going to find out more about female cancers. So tell me, Dr. Chuah, what are the most common cancers that women face and how do we prevent it or detect it early?
I think cancer is something that no one wanted to go near. Okay, we should actually get distant away from it. We should actually avoid it. Okay, and it's bad to get a cancer, but female cancer is fortunately we can detect it very early. We can actually prevent it, most of it, not all, and we can actually cure it. So the common female cancer will be cervical cancer, breast cancer. Endometrial cancer means the lining of the uterus, and the ovarian cancer. This is the four most common female cancer.
I think that is correct, and the number one cancer in Malaysia is actually breast cancer.
So why do I say is easily detected? Because all the female cancer, it has very effective screening tests. Like breast cancer, the most simple one is actually self-examination. I think anyone by the age of 25 years old, they should monthly do their self-examination. And like cervical cancer, although it's actually deep inside the vagina, but it's actually easily accessible. By doing a pap smear, you can screen it, you can detect early, you can cure it. Ovarian cancer, that is slightly more difficult. It's deep inside the abdomen, but we can do ultrasound to detect it. And endometrial cancer, although it's not such a young person disease, but still, if you do annual checkup, you are able to pick it up early. And endometrial cancer is something that it presented, it takes a long time to spread to elsewhere of the body. It can contain in the uterus for a long time. Right? I think for your experience, it's the same thing.
Yes, correct. And then it usually occur among the elderly, as opposed to breast cancer. We have start seeing patients even at young age diagnosed with breast cancer.
Can I ask Dr. Hafizah, the number one cancer affecting women in Malaysia would be breast cancer, and what would be that statistic? Like one in how many women?
1 in 20 women has the risk to develop breast cancer.
I think what's great about listening to both of you is that we can actually detect this early because there are so many screening methods available so that we can prevent this.
Okay, then what about prevention? I say almost all of the female cancer can be prevented. Number one is a breakthrough that people discovered about 20 years ago. Is cervical cancer vaccine. Right now, all of us know cervical cancer is caused by virus. By merely taking of a cervical cancer vaccination, you can prevent 90% of the cervical cancer. That is great. Example like breast cancer. By cell examination, you always detected it early. Number one. Number two, if you're of married age, you deliver child, breastfeeding, it really bring down the breast cancer to risk to very minimum level. The rest, the other two cancers, no prevention, fine, but you can detect early.
Well, what I'm hearing from both Dr. Chuah and Dr. Hafizah is that we can actually prevent this with early detection. So remember what I said in the beginning, right? The importance of screening, to get ourselves screened so we know where we stand. I have a question, Dr. Hafizah. Women are obviously fearful of cancer treatments because of hair loss and, potential side effects, stigma. What are your views on this? How do we understand this process?
Yes, that is a very important question. Understanding about cancer treatment can alleviate some fears associated with this topic. So I'm going to just briefly talk about 4 main cancer treatment. So first is chemotherapy. So chemotherapy actually targets the rapidly dividing cell. However, it can also affect the hair follicles, leading to hair loss. With the advancement technology of scalp cooling machine, it can actually prevent hair loss in patients undergoing cancer treatment. So usually patient will wear it during the course of the chemotherapy treatment. Okay, but another thing that I want to point out is not all chemotherapy cause hair loss. And in majority of the patient, it is just temporary. So that is about the chemotherapy. The second treatment would be radiotherapy. So radiotherapy actually targets or kills the cancer cell by using high energy ionizing radiation. So using the radiotherapy machine, it can accurately target the cancer cell while minimizing the side effects to the surrounding healthy tissue. Third important cancer treatment is immunotherapy. Immunotherapy actually harness the immune system and kill the cancer cell using the immune cell. And in fact, the immunotherapy treatment has been shown to be effective in various types of cancer and has now become one of the standard cancer treatment in a few cancers, including lung cancer, head and neck cancer, as well as kidney cancer. The fourth most important cancer treatment would be targeted therapy. So how targeted therapy works is by targeting certain protein that trigger the cancer cell growth. So as researchers know and learn more about the DNA and proteins that is the driver of the cancer cell, better treatment can be designed and has been designed in order to treat the cancer. So in conclusion, as advancement of this technology progress, we have a better, more personalized cancer treatment to treat each individual cancer.
Yeah, and it actually sounds like there are a lot of options and, even things that can maybe negate how scary this process could be, for anyone undergoing cancer treatment. Dr. Chuah, as a consultant ONG, do you have coincidentally women who may develop cancers while they're pregnant, and how do you address that?
I think cancer, any cancer can happen during pregnancy, but actually the most commonest is actually breast cancer. Okay, other than that, cervical cancer I've seen before, and some pregnant cell turn cancerous, we call it molar pregnancy. Okay, but those are rare. So I think we shall emphasize on breast cancer in pregnancy. Reason is because during pregnancy, most of breast cancer is actually hormone dependence. The hormone increase manifold in pregnancy, so make the cancer cell growth multiply very fast. That's why you detect breast cancer in pregnancy is one of the commonest ones.
May I ask, does it affect, the baby in any way? I mean, it's so young.
I think cancer per se, it doesn't affect baby, but the treatment.
Right, got you.
Yeah. So actually in the principles of treatment of patients, mother always comes first. We always treat mother first. So occasionally we need to give some treatment even though baby is inside. Yeah, I think you may have an example like that.
Yes.
Yeah.
So I have treated breast cancer in pregnancy. So maybe I can share my experience, my previous experience. The lady in her 30s was diagnosed to have stage 3 breast cancer at her 4th month of pregnancy. I think the most important thing is multidisciplinary care. So the obstetrician, together with the breast surgeon and oncologist, need to monitor the patient closely during the course of cancer treatment. So the chemotherapy was started during her 2nd trimester of pregnancy, and she actually successfully delivered nearly at term, which is at 38 weeks of pregnancy. The chemotherapy was stopped 1 month prior to the delivery. Then after the delivery, she completed 6 cycles of chemotherapy, underwent breast surgery, followed by radiotherapy treatment, and currently under follow-up with both breast surgeon and me. And the baby delivered well, healthy, and grow up to be a very cheeky toddler boy.
I'm relieved to hear this. So the baby pulled through, considering what the mother was going through. And I really must say, to your point, Dr. Chuah, that it is important to put the mother first. This is why when we're on an aeroplane, they say that you got to put the oxygen mask on yourself even before your child, that we have to look after ourselves first. Dr. Hafizah, tell me, is there a difference between, say, pregnant and non-pregnant treatments for women who have cancer?
Yes, absolutely. It is actually more challenging to treat breast cancer in a pregnant lady because of safety concern on both mother and the developing fetus. So a personalized cancer care with a multidisciplinary team is very important to make a treatment plan according to the gestational age of the mother, the health of the mother, as well as the stage of the cancer. So I think another thing that is very important is the timing. Chemotherapy can actually be given after the 1st trimester of the pregnancy. Why is given after the 1st trimester? Because during the 1st trimester, the baby organ is still developing, but it is safe to start the chemotherapy treatment after that. Obviously, we cannot wait for 9 months to start the treatment. So chemotherapy can be started during the 2nd trimester onward. And some chemotherapy medication is considered safe for the mother and the developing fetus or the baby. Surgery can be done during pregnancy. So the decision about the surgery is also based on the stage, as well as the stage of the cancer, as well as the stage of the gestational of the baby. Radiotherapy treatment as well as hormonal therapy should be avoided during pregnancy because it can be harmful to the baby. However, these 2 treatments can be started after the delivery.
Right. So, I mean, it really sounds like a lot of factors at play, and this is also why you were talking about a multidisciplinary team. Depends even on the age of the patient. Amazing. I have learned so much from this episode, and I wanted to just check in with both Dr. Chuah and Dr. Hafizah if you have any closing tips or advice or messages on this topic of female cancers.
I think as for me, I think important thing, the take-home point will be all female breast cancer is almost all curable and always detected earlier. So you do not want to get it. You would like to distance away from it, and you would like to prevent it. So please help us to help you. Come forward.
And make sure you do those screenings that they've been talking about, because then you can, through early detection, prevent it.
Another thing that women should be aware of is know your family history of cancer. Because with such knowledge, you can also voice out your concern with your healthcare provider, because certain type of cancer is associated with the genetic predisposition.
Well, ladies, I hope that you feel empowered with the knowledge that was shared today on female cancers. And remember to get yourself screened, not just for your health, but for your mental health and your peace of mind. So I hope that you will see me at the very next episode of Healthy Her, and we look forward to seeing you soon.